This time of year, we often see a rise in cold and flu cases, but another bacterial respiratory infection has seen an increase of cases. Whooping cough has surged since COVID-19 pandemic. Here to talk about whooping cough and how to help protect yourself from it is Dr. Matthew Tenenbaum with Guelph, Wellington, Dufferin Public Health. Thank you for being here, Dr. Tenenbaum.
Thank you for having me today.
First, can you tell us a little bit about whooping cough and who is most at risk when coming in contact with the infection?
Absolutely. So we often think about things like colds and flus, diseases that are caused by viruses this time of year, but there are also bacteria that can cause, infections and diseases that affect how we breathe. Pertussis is one name for it, the one we're talking about. It's also called whooping cough. And essentially, it's a bacterial infection that you can get. In particular, it's for, it's impactful for kids who are quite young, and it can cause a pretty significant difficulty breathing. Typically, it begins with runny nose that progresses over a couple of weeks to produce some really severe coughing and difficulty breathing. And it's called whooping cough because oftentimes you have such difficulty with your breathing and coughing that someone who has that infection, they actually make a characteristic sound when they breathe, which we call whooping. So it has a bit of a characteristic appearance to it. It is fortunately much less common than some of the other things we see this time of year, but it's something that we saw a lot in our community last year. We saw over 50 cases in Wellington, Dufferin, Guelph last year, and it definitely is something that we're seeing in other jurisdictions as well this year.
Now, you just touched upon that defining symptom, but can you talk a little bit about how parents at home might be able to detect whether or not their child has whooping cough versus another respiratory infection?
That's a great question, and it isn't always easy to tell because the early stages of this particular infection do look a lot like colds and flus and the other things that we know are common this kind of year. Runny nose is that classic early symptom. It isn't until a few weeks in that you have that coughing, and even then it can be tricky to tell. I think that the key thing to keep in mind is that whatever bacteria or virus or any infectious agent that's causing someone to feel ill, seek care based upon how that person is feeling. It doesn't really matter what virus or what bacteria is causing it. The key is go see your family doctor, your nurse practitioner, go to hospital if what you're experiencing is severe. Don't necessarily try and guess what's causing your illness. Go seek care as appropriate and leave it up to the doctor or whoever's caring for you to figure out what's causing it. Oftentimes these things do overlap and you can't always tell what it is until you get tested or properly diagnosed.
Now, south of the border, whooping cough has had higher numbers since the pandemic. Has that been a similar situation here?
So we saw a significant increase in 2023 and 2024. We saw about 25 cases in 2023 and about 50 cases in 2024, which are well above what we usually see. So far this year, we've only seen about 5 cases. It has gone back down to much lower levels that are more typical. And we're almost at the end of the year, so we're expecting it's going to be a lower year overall once we hit the end of the month. But we do know that the past couple of years in our area were atypical, and we're glad to see that has come down since recently.
Now, is the whooping cough vaccine mandatory, and who should be getting it?
So the whooping cough vaccine is a vaccine that's offered for kids who are really young as 2 months old. There's multiple doses you get. 2 months, 4 months, 6 months, repeating at 18 months, age 4. So you're kind of getting this repeated exposure to this vaccine over childhood. It is also recommended as a booster for teenagers, recommended as a booster in adulthood as well. And for people who are pregnant, it is now recommended that every pregnancy you get this vaccine. We do know that the vaccine is very effective at reducing your risk of getting whooping cough. However, that protection wanes over time. And so for those who are at highest risk, it is important to make sure you're up to date.
All right, very timely information indeed. Thank you so much for that today, Dr. Tenenbaum.
Thank you very much.